Hi everybody, I'm Renee. I'm one of the dietitians here at WellSpan Bariatric Surgery, and today we're going to be talking about advancing your diet right after your bariatric surgery. So what we'll be talking about today is each diet stage very specifically. We'll be talking about how you'll introduce new foods and tips for tolerating new foods. So this is an overview of what the first 5 to 6 weeks will look like right after surgery. So as I mentioned, we have you follow a very specific plan, and the reason we do that is entirely for your safety. We want to make sure that you're healing properly and that the risk of complications are as low as possible. So I'm going to tell you what each stage is and for how long you'll be doing it, and then we'll talk about each one in greater detail. So you'll start with the clear liquid diet. That'll start a day or so after your surgery, and that only lasts while you're in the hospital. Next, you'll go home and you'll do your full liquid diet for 2 weeks. Then you'll transition to pureed or blended foods for 1 week, then soft foods for 2 weeks, and then you'll be into a more regular eating plan. So let's start with the clear liquids. As I mentioned, this is only going to last while you're in the hospital, so just a day or two. So the goal this day is just to stay hydrated. We're not focused on protein yet or calories. What we want you to aim for is 64 ounces. Now, it's unlikely the day after your surgery that you'll be able to achieve that much, and if you don't, that's okay. What we want you to work on is just sipping constantly throughout the day. So a good goal is 1 ounce every 15 minutes or 4 to 6 ounces an hour. Now, as you're in the hospital, the nurses will be helping you measure out your fluids and work on really taking your time with those. If you were to feel overly full or nauseous or even to get sick, it's okay to stop and give yourself a break. Now with our clear liquids, those beverages can have color, they can have flavor, but we have to be able to see through them. That's why we call it the clear liquid diet. We want our beverages to be sugar-free, decaffeinated, and non-carbonated. So let me give you some examples. So of course, water would count as a clear liquid, and that can be regular water or even flavored water. You can do things like sugar-free Jell-O as Jell-O and sugar-free popsicles. You can do decaf coffee or decaf tea. You just can't add any milk or any creamer to it. You can do any type of broth that you wish, or even flavor enhancers like Crystal Light, Mio, or any other brand that you like, or things like Gatorade Zero or Powerade Zero. So again, the goal here is just to maintain hydration. So you're just going to be sipping very slowly. You can't do a whole lot beverage-wise, but again, that's the purpose. So up next is the full liquid diet. So this is going to start as soon as they discharge you home, and this will last for 2 weeks. So at this point, we're not only focusing on staying hydrated, but we're also focusing on our protein. So our fluid goal remains the same, 64 ounces. And we're going to talk a little bit more about the difference between the two, but about half of your intake of fluid should be the full liquids, which are new in this stage. The other half is the clear liquids. So that's what you did previously. Those things you're going to still continue. So our protein goal is 60 to 70 grams per day. So you heard in a previous class how important protein was. And it is very important to get as close to this goal as possible after your surgery, because it's going to help with healing, it's going to make you feel better, it's going to help keep you full throughout the day. So as close to this goal as possible is best. Similar to the last stage, you might not achieve your goals right away, and that's fine, but we want you to do the best that you can. So like the clear liquids, we still want to sip constantly on our fluids throughout the day. We don't want to exceed the 8 ounces per hour, so still kind of aiming for 4 to 6 ounces. Let me give you some examples. So our full liquids are the things that are going to have the protein in them. So that would be like skim milk or 1% milk. You can even do soy milk if you're lactose intolerant. You can do strained soups like cream of chicken or tomato soup, but you cannot have any chunks of food in them. You can actually do yogurt. Greek yogurt especially is high in protein. Now yogurt you might not really think of as a liquid because it is of course a little bit thicker. So we recommend adding a little bit of milk to that just to thin it out a bit so it is a little bit more liquidy. You can do things like sugar-free hot chocolate made with milk or even sugar-free pudding. Now, one really important part of the full liquid diet is protein shakes. So here are some examples. You can see there's powders and there's also pre-made shakes. So we have more guidelines in your notebook about what you should look for when you're deciding on a protein shake. With our protein, we want to try and get at least 20 grams of protein per serving. You can see in the example here, the Premier Protein, which is just one of the many brands that you can do, that actually has 30 grams of protein per serving. So that's half of your needs for the day. Now that's going to take some time to work through since we're sipping on it, but that can still help you get closer to that goal of 60. So while you're waiting for surgery and you're getting ready, use some of those examples in your notebook and try some different things. See what you enjoy and find what works best for you. Another option during the full liquid stage is to add unflavored protein powder into different fluids. So that you would just find a tub of it or a bag of it. There's a lot of different brands out there. And you can add a little bit into your soup or into your yogurt or into your pudding, and that's going to boost your protein content throughout the day and ultimately get you close to that goal of 60. So that's the full liquid diet. Like I said, that's 2 weeks. Next, you move into your pureed or blended foods, and this is going to last for 1 week. Now, I know most of you, this probably doesn't sound overly appetizing, which I can understand, but the purpose of this is to progress your stomach into solid food. So the pureed food, what we're doing is we're actually adding our food into a food processor or into a blender, and we're mixing it with fluid. So it's the consistency of baby food or of applesauce. So here, our fluid goal, like always, is still 64 ounces. Our protein goal is 60 to 70 grams. Hopefully by this point, we're getting pretty close to achieving those goals, okay? So as I said, our food must be pureed. So we're adding it into a blender, food processor, and we're mixing it up. You're going to be eating about 1/4 of a cup at a time, which is about 2 to 3 ounces. Now, as you remember hearing in another class, we want you to follow the 30-30-30 rule. So just to review that, we're not drinking 30 minutes before we eat. We're taking 30 minutes to eat our meal, and we're waiting 30 minutes after our meal to drink anything. So it's especially important here to take that 30 minutes to eat. If you eat too quickly, you can upset your stomach. The food can feel like it's stuck here even, and you could potentially get sick. So set a timer, whatever you have to do to make that 30 minutes last. So let me give you some examples of the foods that you can have. So you can do just baby food if you would prefer to do that. It's already that consistency. Sometimes that's easiest. So you could do baby food meat, you could do baby food vegetables, either of those. You can make your own pureed meats. So let's say you wanted to make pureed chicken. You would bake chicken like you normally would, cut off about 1/4 of a cup or about 2 ounces, add that into your blender, and then add, let's say, chicken broth and blend it up. You can do refried beans, you can do hummus, you can do cottage cheese, ricotta cheese, you can do yogurt as it is. You don't have to thin it down like you did previously. And you can even do some fruits and vegetables. So canned green beans you can puree, or steamed carrots. You could puree canned peaches or pears as long as they're canned in their own water or their own juice. Now remember, our protein is always our priority. So if you're only doing applesauce, carrots, you're not really going to get any protein at all. So you want to make sure with each of your meals you have some form of protein. Now, as I talked about in the previous slide, you can add that unflavored protein powder into your food and your fluids. It mixes really well into the pureed diet too. So feel free to continue to add that in. Some people will still use their protein shakes because with just 3 meals a day of about 1/4 of a cup, it can be really hard to reach your goal. So it's okay to do a protein shake in between your meals, Or even if you wanted to do it for one meal, that's okay as well, as long as you are introducing some of these pureed foods into your diet. So that's the third stage. The last sort of stage is the soft food stage. So just to recap, clear liquids for about 1 day or so, full liquids for 2 weeks, pureed foods for 1 week. Now we're at the soft foods, and this is going to last 2 weeks. So this is a little bit more of regular eating. We no longer have to blend our food, and we're slowly introducing new things into our stomach. As expected, the fluid goal is 64 ounces. This can still be somewhat hard to achieve because we're following the 30-30 rule, and we're only drinking in between our meals. So make sure you're always mindful about carrying fluid with you and sipping on that constantly when you're not eating. Protein goal, still 60 to 70 grams a day. We're going to talk about the different protein foods that you can have. It can still be hard to achieve that with just the 3 meals. So again, if you do need a protein shake or you need to use that unflavored protein powder, you are welcome to do that. So with our foods in the soft food stage, we want them to be soft enough so that we could mash them with a fork. If you have to take a knife and cut them, then it's not soft enough. So what you want to avoid is any type of raw or stringy vegetable, raw fruits or anything with a skin or seeds, tough meats like steak, ground beef or pork, and nuts. What other things that we want you to avoid include bread, pasta, and rice. Now I know that those are by definition soft, but they don't fall into the bariatric soft food group. So these things actually need to be avoided for at least 3 months because of how they're digested. So when you eat them, they get very gummy and they form together and form almost like a ball, and that starts to expand in your stomach. And it can feel stuck. It can feel stuck here in your chest or in your stomach. Sometimes it even comes back up. So bread, pasta, and rice must be avoided for at least 3 months. So let me give you some examples of the soft foods. So you can do things like chicken. So that can be canned or cooked in a crock pot or instant pot. You just want to make sure it's nice and tender and soft. You can do tuna. You can do turkey. You can do fish like salmon or cod. You can do cottage cheese, yogurt, eggs. You can do regular cheese, soft fruits and vegetables like steamed carrots or green beans, canned peaches and pears. You could do unsweetened applesauce, but again, nothing with a skin, nothing with seeds. So that's the soft food stage. Our last stage is the regular diet, and at this point, you're not really following a stage anymore. You're kind of transitioning into normal eating and how you'll be eating for the rest of your life. Now this is at about post-op day 36. So post-op day 36 and 1 year post-op are going to look a little bit different. But when you first start this stage, you want to slowly introduce foods one at a time. So you want to try something by itself first before you try it in combination with everything else. So there's no longer texture restrictions here, so you can try some of those tougher meats. You can try raw fruits and vegetables. You can try nuts. So slowly add those in. No rush to add them in, and one at a time. At this point, it is important to make sure that you're eating on a schedule because most likely you're not going to be experiencing hunger signals like you did before your surgery. And if you only eat when you're hungry, you're never going to get enough nutrients or protein that your body needs in order to really feel good. So make sure you keep yourself on somewhat of a schedule and eat at least 3 meals a day. When you're eating, as we've talked about all along, your protein is your priority. So protein should always be first. At the beginning of this regular stage, it might just be protein and that's all you can eat. And that's fine. It's going to feel a little bit unbalanced and that's okay. Eventually, as you're able to eat a little bit more, you can do your vegetables second and your starches or your fruit last. But protein must always come first. If you still struggle with tolerating things like dry chicken or dry meats, it's okay to use things like fat-free gravy, a low-fat cream soup, or broth to kind of keep that meat nice and tender and moist. One other thing with the regular diet that we really want to watch out for is avoiding snacking or picking and grazing all day long. So at the beginning, this usually isn't an issue for most people, but as you progress, it can be really easy to take a bite of something here and a bite of something there. And that can really add up calorie-wise, and we want to make sure we're avoiding that. So if you really do need a snack, if you're genuinely hungry, it's okay to eat something, but make sure, again, it's protein-based. As you remember, protein stays in our system the longest, so you want to always have protein at your meals and snacks, and just watch out that it doesn't turn into endless picking throughout the day. So one more thing with a regular diet. When you first start this stage, there are still some foods that can be difficult to tolerate. Like I mentioned, sometimes dry meats don't always go down very well. So make sure that you do use moist cooking methods if you need to. So steaming, braising, poaching, slow cooker or instant pot works really well. Make sure when you're eating dry meats, you take very small bites and chew until it's basically nothing in your mouth. Marinating your meat ahead of time can kind of also help keep it tender. Some people struggle with raw and stringy vegetables right off the bat, so lettuce, celery, asparagus. Sometimes those things don't always go down as well. If that's the case, don't be frustrated, don't give up. It doesn't mean that you won't ever be able to tolerate it, but you just need a little bit more time. So give yourself a few weeks and then try it again. And then, as I mentioned previously, bread, rice, and pasta must be avoided for at least 3 months after your surgery. And even when you can add those back in, you have to remember that those are high in carbohydrates, so we don't want those every day or at every meal. So in your notebook, you'll find a few questions regarding this information that we just talked through. So take some time, go through those and answer them to make sure you're understanding everything. And we're also going to have you work on an activity to bring to your next one-on-one appointment with a dietitian. So what we want you to do is plan out a sample post-op meal plan for 4 diet stages after surgery. So you don't have to do the clear liquids, but for full liquids, pureed, soft, and regular foods. Now you have a list of all the foods that are allowed in your notebook, and you have samples of what a day could look like for each of those stages. So what I want you to do is start with your full liquids, look at that list, and figure out what fluids you would do, what things you like, and then plan a sample day. So keep in mind that you every hour are going to be doing something. It doesn't mean eating, but at least drinking something. So with your fluids, let's pretend that this sample I have on the screen is your full liquid diet. So your portion size, it's going to be about 4 to 6 ounces for fluids. Then you're going to write in whatever the food or beverage is. Try and figure out the protein using your notebook or searching on the labels or online, and then how many ounces of fluid. So we just want to make sure that you can understand what's appropriate for each diet stage and that you can kind of formulate your own plan. And then you're going to bring that to your next one-on-one appointment with your dietitian, and we're going to walk through that together. Anything we think that maybe needs to be tweaked a little bit, we can work on that. So thanks for listening. I hope that this was helpful. I know that this is a lot of information, but it is important information. So like I said, at your next session, we'll talk more about these things together. But in the meantime, if you have questions, please feel free to reach out through the portal or calling our office. Thank you.